All right, we're back with you for our last segment about Medicare. We have Catherine CVA with AARP, Steve Edmonds from Alliance Insurance Services. All right, we're going to make this clear one more time. This person says, isn't it true that if you work for a company with 20 plus employees, you don't have to sign up for Medicare Part B until you lose your work insurance? Steve? Catherine?
Okay, so the safe thing to do is always talk to Social Security. You might as well sign up for Part A because it's free. It doesn't cost you a premium. The Part B, if you work for a company and the 20 employees or more, that is true. And if their coverage is what is by the government, if it's called credible coverage, then you can defer Part B until such time that you retire later on down the road. Also keep in mind in me saying that once you retire and you no longer have that group insurance, then you'll want to sign up for Medicare, and you have to do it within a gateway there. You can't wait just to whenever you feel like it. You have like 60 days during a special enrollment period after you lose that group coverage or it's cut off. And then you still have to sign up for Part B if you don't want to be penalized the rest of your life.
So I think
yeah.
where people get thing is that you have to sign up, or you at least have to defer at that point in time when you sign up for Medicare. If you don't check that box as you're signing up for Medicare and you leave it empty, then that's the problem.
Yeah, that can definitely be a problem.
Okay.
Sure.
So
check with your human resources department or your benefits manager, because they can tell you if it's credible coverage.
Right. Credible coverage is the thing, and you want to make sure that you're checking that box. All right. So this person says, why are sometimes premiums different? My husband was asked to pay $340, way above that $170 that you talked about.
So Medicare is based on income. And so if you're paying that much of a premium, then you are likely in a high income category. The lower end of the income on particularly Medicare Part B is on a sliding scale, but you have to make sure that you are within that realm. And that is where, when you fill out your Medicare forms, you have to indicate your income.
Gotcha. This person's asking, what Medicare plan covers over-the-counter meds?
That would be your Medicare Advantage plans. We just talked about that during the last segment. Medicare Advantage plans are typically plans that are going to be relatively low priced when it comes to premium. And they're going to give you a lot of bells and whistles. They're going to give you stuff like dental, vision, hearing, over-the-counter drug card, where you can buy a lot of your Tylenol, ibuprofen, vitamins, and stuff like this. But you're going to have out-of-pocket expenses on Medicare Advantage plans every time you use it, like when you go to your doctors, when you get scans and x-rays, when you're admitted into the hospital, when you have outpatient surgery. All these things you're going to be paying copays for. Whereas if a person had traditional Medicare with a Medicare supplement or a Medigap plan, it's typically going to pay about 100% of all medical costs, but it's not going to include any of those bells and whistles that we just mentioned. So, you have to get with a good licensed agent, when it comes to surveying this, and let them thoroughly go over all this, and you can make good decisions then based on that.
Well, that brings me to this. AARP has a tool that can help you. It is like an online tool that can help you, and you can put in different things, and you can go through different filters and that kind of stuff. But also, when you talk to, you just said it, Steve, when you talk to an insurance agent, I think a lot of people think that if I talk to an insurance agent, that means it's going to cost me money.
No, it does not cost, and most insurance professionals are glad to help you and glad to speak with you about these different types of coverages. So never hesitate there. Always call and check. It's good help.
Okay, this person says, if you already receive Social Security disability, do you have to do anything different when you turn 65?
You should already be covered. If
okay,
you are receiving Medicare, but not all people that are on disability are fully covered. So if you don't know if you are, you need to meet that 65 window.
Okay, gotcha. This person's asking, oh, go ahead. Did you want to add something?
Yeah, Tanya, I would. A lot of times when people are under 65 on disability, they go with the Medicare Advantage plans due to it being a relatively low premium because the Medigap policies are really expensive if you're under 65. So at age 65, that opens a window up where a disabled person can get a Medigap policy at a standard price. So it's important if you're on disability when you turn 65, it's still good to check with your insurance person there because you could get some extra help and benefits there that's going to be an open door just because you're turning 65.
Okay, and that just answers the question of this last person who says, I'm 3 months before turning 65. What do I need to do? I'm disabled and on SSI. You need to check to make sure that you're fully covered with Medicare. Chances are you are fully covered, but you'll want to check that as well. This person says, I'm going to be 65 in March and I have coverage through my company. What do I need to do to avoid penalty? Catherine, really quick.
Talk to your HR folks to see if your coverage meets the criteria for waiving Part B, and also understand what you're paying there versus what you might pay with Part B, and make the best decision for you.